Joining us right now as we prepare to hear from the Secretary himself is Dr. Megan Ranney, an emergency room physician and Dean of the Yale School of Public Health. It's great to see you again, Doctor. How do you assess Robert F. Kennedy Jr.'s tenure so far as Secretary and the impact that he's already had on the nation's public health agency?
Well, he's certainly had a big impact so far. Unfortunately, what most of us are seeing on the ground is a negative impact, really in three areas. The first is around information quality and trustworthiness. You know, one of the things that RFK Jr. came in pledging to do was to get America's trust back in public health, in medicine. I don't know anyone who works in these fields who would say that we didn't need change to improve the public's trust. But what we're seeing is decreasing trust. A recent KFF poll says that only about half of Americans trust the recommendations from the FDA right now. That's down from 2/3. Similar data on CDC and NIH. Parents and doctors and public health officials don't know where to turn for good data right now. And that has changed significantly. That has gotten worse over the last 100 days. And then the second big area, Kate, is around the science and the structures that keep us healthy. Again, we can and should do better, but what we're watching happening right now is not reform. We're watching destruction of some of the things that are actively keeping Americans healthy. I mean, I'm hearing from cities and states that are thinking about disbanding parts of their public health agencies because of the decrease in funding that comes through the CDC. We're watching things like naloxone programs that are a proven strategy to reduce opioid overdoses getting shut down. Community violence intervention programs getting shut down, mental health support for kids in schools getting shut down. That's really disturbing because it makes it so that we're going to be starting from a place that's further back in terms of Americans' health.
I want to play for you what one member of the Senate committee that he will be testifying before said to me. Democratic Senator Tim Kaine, he was on with us just last hour, talking about his focus when he speaks with the Secretary today.
I think I'm going to focus on the massive cuts to staff. When you essentially shutter the agency that is responsible for mine safety, we have a lot of coal mining in southwestern Virginia. When you make dramatic layoffs to the FDA, responsible for the safety of our food and our medicines, then what you see is not only layoffs, but significant effects of constituents. These massive layoffs end up dramatically affecting the quality of service that they get.
And what Kaine was getting at is how Robert F. Kennedy Jr., as you said, had a big impact. He's moved to completely reshape how HHS operates since moving in. I mean, Kennedy has said that the cuts are necessary to refocus the government on tackling chronic disease. But do you see evidence that that's happening?
Oh, listen, I'm a dean of a school of public health. We do a ton of work on chronic disease, on nutrition, on environmental contaminants and how they affect health, on diabetes prevention, on cancer. Instead of seeing increased support of those programs, we're seeing active cuts to the science that helps us figure out how to stay healthy, and cuts to the programs that are already in place that put the science in effect to help communities. And I'm hearing from people on both sides of the political spectrum. You know, I don't work for Democrats or Republicans. I work for the sake of America's health. And I'm hearing from folks on both sides a frustration with both information quality and with access to the care that they have come to depend on. Again, we can and should do better. Many of us are on board with the need for reform, but we're not experiencing reform. We're experiencing destruction.
Doctor, thank you for coming on. I'm very interested to listen closely to hear how Robert F. Kennedy answers some of these questions today. Thank you so much.